So there are many reasons why there will be a challenge in adherence. Yeah, people may not comply with their treatment options. Number one, because it's not affordable. You're giving me a drug that costs me maybe 200 shillings a day. I'm not able to afford it. Hello, everyone, and welcome to Beyond Conditions. And this is a season where we're looking at health communication. Beyond Conditions is a forum that provides insight, influence, and resources to those of us who journey with chronic conditions in order for us to realize a full and fulfilled life. And we do this in collaboration with our healthcare workers and our caregivers as we navigate the intricacies of healthcare. And I'm your host, Trish Barasa. Today, joined by,
Marilyn Josephine.
yes, and we're really going to be going into more of the healthcare communication. And in today's episode, we are looking to discuss economic factors and how this impact healthcare communication.
So, economic factors, what are they and what do you mean by economic factors in health communication?
Uh, so economic factors within the healthcare sector are really funding and resource-related aspects that in one way or the other influence the delivery, the accessibility, and the outcomes within the healthcare sector.
Okay.
Yeah.
So,
Any
an
example?
example
Yes.
would help me because
Yeah.
me, I only think of money when it comes to economic factors.
Yeah. So one example is income. And we can see that we have different levels of income, and this would one way or the other introduce some disparities. And then we also have issues like education.
Oh,
Yes. Yeah. It's an economic factor. We also have health literacy, where now you're learning about specific aspects of health.
yeah.
Yeah. And we have many other, including infrastructure and even technology. Yes.
So they affect the accessibility, affordability,
Yes.
and even the quality.
Yes, they do. Because then you're looking at communication that's happening within the healthcare sector. So as you're communicating, as you're shaping messages, as you're sending out messages, yeah, you are seeking to do this in a way that is reducing the disparities because of the resource-related factors and funding. Otherwise, they can be a way to introduce disparity in
And
themselves.
how can this be addressed? Healthcare costs.
Healthcare costs. So in terms of communication, first you want to look at it in terms of openness, because you have insurance.
Insurance coverage.
Yes, insurance coverage. You have government funding. Yeah, and with this in mind, as you're communicating, because you're dealing with a patient or you're dealing with a community, you want to do it in such a way that there's openness and there's clarity. The communication is very clear, because that's one way in which a patient or even a community can then seek health and know that they can be able to realize better outcomes. Otherwise, if I don't know what my options are, for instance, insurance or government is funding Linda
But
Mama.
sometimes there are financial assistance programs.
Yes.
And the private sector also helps a lot.
Exactly.
In healthcare costs. Because you find that sometimes an NGO or an organization comes and they assist people to cater for their medical bills.
Yes, and that communication is what now should be done. You've even seen there are times hospitals like the private sector, within the private sector, like Aga Khan, have run campaigns on diabetes or on hypertension. At the same time, government is doing something on its part. And at the same time, you as a healthcare worker want to ensure that these messages are out there to those that need it, so to reduce disparities and people are able to improve their outcomes and access healthcare.
So you've talked about government playing a part in this. I think resource allocation is very important in this matter too. So how does it affect, or what role can it play, or does it play in economic factors in healthcare?
So resource allocation in government, first of all, will affect service delivery. Yeah, and this is because when government decides to put in money towards something, and this is being done in order to access even the rural communities, then that message gets out there. But when government doesn't do that, then it's possible that someone will not even know there's a polio vaccine campaign. Yeah. So through government, because government is the service that we all can access, and through them putting funds towards the particular healthcare communication, the messaging. This is one way through which then we can realize whatever health outcomes we are seeking. If government doesn't fund, and these are policy-related issues, which we'll discuss on a deeper level in our next episode. If they don't fund, then that sector will not have the necessary resources to carry out their activities or programs.
But the government can also train people. For example, the community-based caregivers.
Caregivers, yes. Yeah.
It is a recent development, and according to the feedback, it has really helped, because now they're coming at you at your own personal level.
Yes, and we used to have this in the past through public health. We used to have public health officials in the past, and now we have the community health promoters,
health promoters,
yeah. About 130,000 of them were recently put in, because government is seeking to bring back, and this is geared towards preventive care.
Preventive.
Yes, as opposed to curative. Yeah, you want to prevent someone from getting there. You want to send out messages that go and seek screening for early diagnosis. You also want to send out messages that there is vaccines. Or you also want to send out messages that if you change your lifestyle in this way and that way, you will not get this and this and this, which then will affect your health outcome in one way or the other. Yeah.
But Trish, I can't help but wonder that even in as much as government resource allocation plays an important role, but infrastructure also plays a big part, because as per my understanding, the information might be there, but we will get it differently. For example, a campaign run on television, and a campaign run on radio. Between the person listening and seeing what is being talked about, the person seeing and hearing will benefit more, because you can see and then you have a better chance of remembering or even understanding better.
Yes.
So is there a way that can be addressed, or is it really an issue?
It's an issue, yes, especially to the underserved populations. And it's also an issue within the rural population. And I have seen instances where government has sent out programs and campaigns which go even to the market areas. And through media, they're able to reach out and to send out messages on one thing or the other that's health related, that we are currently offering malaria nets to all mothers who are expecting. Yes, or all children under 5. So this you can do through media. Yeah. And you can also send out the messaging again through the community health promoters. So in one way, it's channeling, because that's what infrastructure is. Channeling, yeah.
Okay.
Yeah, because it will affect delivering of the particular message.
So how can healthcare providers discuss treatment options?
So treatment options, I would look at it broadly in terms of you have this particular medication that you should be using, and you want to let the patient know that this medication is available at this cost. So you're looking at affordability. And this is based on your assessment of where this patient is coming from. Yeah. You cannot just throw a very expensive medication or treatment option to someone who cannot afford it, or where this service is not even available. Maybe you're telling them to go for kidney dialysis. Yes, and it's not available. And then at the same time, you're also letting them know that there's this funding that's being carried out by so-and-so, yeah, for these particular treatment options.
Yeah, I've seen interviews
Yes.
where people were saying that it's their doctor who stopped them from giving up on medication when they're
Yes.
chronically ill, because they were advised to maybe try a program. There was a research, so you become part of a research
Yes,
or
the
something
clinical
like
trials.
that. Yeah.
Yes, exactly. Yeah, so it's the doctors a lot of time know these programs, and presenting your patient, you've made an assessment of the patient. You've realized this patient is coming from an underserved community or population. You make that assessment and make this, you make a provision for these treatment options to them.
Okay.
Yeah, then they can know that this is available. The government is currently funding this and that. The private sector through this and different individuals, organizations are carrying out this, and you're able to help this person to get the best treatment that they can at an affordable cost. Yeah.
So ever since we started being here, we always talk about health literacy. We never fail to mention health literacy,
Yes.
culture,
Social
social factors. Yeah.
yes.
So how does health literacy affect this?
Economic, how does it come in through the economic factor? So health literacy is really just the same thing. You're learning more about the different issues that you're faced with. For instance, it's just broad out there. You're talking about asthma, and that it affects children who may be allergies and all this and that. And we have just come out of the breastfeeding week. Do you know that breastfeeding actually influences allergies?
How? For the
Forget
good
the
or
it's good, yeah, for the good. Forget
Okay,
the deeper insights, but an individual who's breastfed perhaps for the longest recommended period, which is 2 years, and this is, you're talking about
2 years.
yes, exclusive for 6 months. There's normally recommended exclusive for 6 months. After 6 months, you can introduce weaning, and then now go on to the 2 years.
I went past 2.
Yes, yeah, but the recommended is 2 years. So when you have an individual who's aware, a mother who's aware, then they will know that this could help the health outcome of my child, or a father who's aware. So that's health literacy. It's just understanding of how you can be able to improve on certain aspects of your health.
So it will help an individual make better and
decisions.
quality, well-informed decisions.
Exactly, yeah. You empower
Because
that
if you're
individual.
telling me what my condition is and I'm not getting the full picture, my judgment will be biased or impaired.
Exactly.
But if I have a better understanding, then I can make a better decision for myself and a favorable one for everyone involved.
Exactly. And it can be, I mean, there is a participatory approach because you are aware of whatever implications or factors will affect your health.
Okay.
Yes. So you go for it and you know that this is what I need to do. And you're able to say that failure to do this, or if I do this in this way, then this is the outcome of my on my health.
Okay, so you've said the community health promoters promote preventive health approach. How can this be done? The preventive
approach. Now, again, within the communication, you're looking at it in the broader communication aspect, yeah?
Preventive care.
Let me take case in point malaria. If a community health promoter who's supposed to attend to 10 houses or 100 houses goes round to the different targeted individuals and gives them information about cutting their grass short and clearing puddles of water within their homestead, that home is likely not to have the breeding of mosquitoes and malaria, which is what you'd get from malaria bites. The other thing is, again, if you educate this community as a community health promoter, that when you eat certain foods, these foods are likely to improve your health or they are likely to affect your health.
For example, in the case of diabetes.
Yes, yeah. Yeah, and adherence to treatment. Maybe you're going to a patient who is living with HIV/AIDS, and you're letting them know that if and when you adhere to your treatment, the outcome on your health is better.
To prevent
Yes.
defaulting.
Yes, as opposed to defaulting, as opposed to, or should you be on these drugs, do not take alcohol. So now you're doing it at a community level and you're telling them, don't go and drink if at all you're taking this and this medication.
So by preventive, it doesn't necessarily mean preventing me from getting it. It means I now have it. I am living with it, but this is what I can do not to aggravate it further or to improve it.
Yeah. And also you're basically telling people, go for polio vaccine. So they will not get polio. Yeah. You can see we've eradicated polio. How have we done it? There's been campaigns and communication out there.
But preventive is just not about if you don't have it. It can also be after you've gotten it.
Yes.
What you should and shouldn't do
Exactly.
with your medication or with your health.
Yes.
For example,
So
if you have a chronic health condition, you avoid smoke,
yes,
dust, and extremely cold places because you fail to breathe well.
Yes, exactly. Yeah. So what to do? Yeah, so that you prevent any aggravation on the condition.
But sometimes I have an illness. I want to access medical assistance or healthcare, but I'm financially unable to. Financial constraints.
Yes.
Limit me or prevent me from getting it.
And that's a barrier. And it's also, again, a key aspect of economic factors. Now, here you're looking at letting the patient know that these are the options. Yes. Maybe you can take this or you can take this. You can seek this funding. Yes. And this is what is available. Or your insurance won't cover this. And you're not doing it in a way to intimidate them. You're doing it in a way to help them, to empower them, make a decision on the options.
There are cases where people got medical treatment and now they're stuck in hospitals. Yeah, because they've been unable to pay or clear off the debt. Now you've recovered, but now you're stuck in the hospital.
Yeah. And the healthcare workers can help you. They can let you know that, these tests will cost this much. As opposed to you finding out when your bill is out. Yeah, you can be told, if you get a CT scan, the CT scan costs you 20,000 shillings. And then you can be able to make an assessment and judgment and work together with the doctor. Let's not do the CT scan. Maybe we can do the CT scan. Can it wait till next year when my insurance is still is full? Because now maybe this year it's exhausted.
So what about telehealth and digital communication?
Now, this make access to healthcare very effective and efficient.
How? May think it's an inconvenience to the doctors themselves.
Well, for starters, you have virtual sessions. You can actually record them. Oh. Yes, you can record because you know that maybe these are patients who need to be told 1, 2, 3, especially for a clinic. Yeah, have you been taking your medication? Maybe are you checking your blood pressure? Maybe has your child been kept in a warm place because of the asthma? Yes. So that communication, you do not need to attend it physically. So already you've cut costs that relate to logistics.
Oh, yeah.
But it can create a disparity in that, do I have access to technology? There is that divide. Yes, there's that divide, digital divide. So, but when access is made possible, and it is through technology like telehealth and the others, then it actually cuts costs. It's very effective.
Effective, but sometimes, it's also effective because you have the doctor at your fingertips. I'm not feeling well, or I'm suddenly not feeling well. I can just take my phone. Hey, doctor.
Yes.
Not feeling well. What's the problem? And then I get diagnosed. If I need to come in for a physical checkup, I get advised.
You can come, yeah. So that's the effectiveness that we are looking at. And it's real time. It's effective. You don't need to move. You cut out on time. You've cut out on logistics. If it was going to take you 2 hours to go there.
If you meet a fraud online claiming to be a doctor?
And so this is why it's important for us to ensure that we're working with regulatory bodies closely. You know that this is a hospital or this is a service that is supported by renowned institutions or government. Yeah. And government can also support within the policy framework by shutting out certain fraudulent people.
Okay, to finish it off, how can healthcare providers discuss medical adherence?
So there are many reasons why there will be a challenge in adherence. Yeah, people may not comply with their treatment options. Number one, because it's not affordable. You're giving me a drug that costs me maybe 200 shillings a day. I'm not able to afford it for more than a week, and I'm supposed to take it for 2 weeks. So you can discuss it with the patient, and the patient can know that this is not within my income reach.
I remember the first maandamano. One of the reasons was because apparently some medications were going to be taxed, and now they are going to become too expensive for most people to afford them. The cancer medication.
Yes, yeah.
That was one of the reasons why people
Why people were on the streets.
Yeah.
Yes. There was health related issues, and you're also aware that two of the major pharma companies left Kenya, Bayer and Glaxo.
Why?
Because of economic conditions within the country. So when government again is able to provide incentives and taxes, we can be able to realize, and this is policy framework which we shall discuss in the next episode. Yeah, we can be able to realize better health outcomes through communication. And again, this must be communicated that cancer drugs are now subsidized.
Okay.
Yeah.
So what should I take with me home today?
The take home for today and for you viewers as well is economic factors affect equity, which in turn affects effective communication within the healthcare system and sector. So economic factors, equity, effective communication.
I know we are out of time.
Yes.
But the last thing I want you to clarify on is equity.
Equity being that as opposed to equality, where you're giving everyone the same thing, you're saying education, class 8. You're looking at someone and realizing that this population is underserved. So I need to send more resources towards this population.
Okay.
This population is better off. I think some of you have seen the meme where someone is standing on a longer stool and someone else is on a shorter stool, so that they all realize the same height. That's equity.
Okay.
And equality is everyone is on the same length of stool. So someone who's taller would be able to
be taller.
Yes, would out tall the others. Yeah, so that's now where we look at equity, because in that sense you're able to send resources to where they are most needed and to realize fairness and justice.
Okay, thank you. I hope you've learned the way I've been educated today. I've learned a lot of new things. You can catch us on our social platforms.
Yes. We are available on our social platforms on YouTube, on TikTok, on Facebook, on Instagram. I think across all social media.
You can
and
always
even
comment,
X, yes.
subscribe, like, and share.
Yes, and we would love to keep engaging with you in this conversation where we're looking at healthcare communication for us to realize better health outcomes.
Okay.
Yeah. So thank you, viewers. I've been your host and your health advocate, Trish Barasa.
And I'm still Marilyn Josephine.
See you again. Bye-bye.